Hello everyone, myself Mayuri Ragwani, the team lead of Atharvaveda. Currently serving as Secretary of Silver Oak University IEEE Women in Engineering Student Branch Affinity Group and pursuing my 5th semester in Computer Engineering with specialization in Artificial Intelligence and Machine Learning. Now let's shift our focus on a project. Imagine this, a patient walks into a government hospital hoping to get a treatment quickly, but instead their journey begins with a long queues, paper forms and multiple files moving from one department to another department. Now imagine this happens to hundreds of patients every day regularly. The challenge isn't lack of skilled doctors or dedicated staff, but here the challenge is manually managing the documentation system. A delay in one department quickly impacts on different department. It can be an administrative, healthcare, medications and many more. As a result, valuable time which should be spent for delivering a care to the patient goes shifted to the documentation. So we ask a simple question. What if every hospital could go be connected through a single digital platform? That question becomes the foundation of our solution with our project DHOP, District Health Operational Platform. This is a prototype of our project DHOP, where you can see the login dashboard. As soon as the administrator logs in, they are presented with a unified dashboard that provides a real-time overview of all health centers under their jurisdiction. At the top, key operations. You can see the active centers, patients' registered history, bed utilization, low stock medicines, staff present today. For the smooth coordination, this allows administrator to quickly identify critical issue without going through multiple registers or reports. Below that, quick action provides instant access to district reports, system notification, and data exports, enabling faster decision making and efficient communication. The dashboard also includes the visual analytics that tracks the patient registration, bed utilization across different healthcare centers, medicine storage, and staff attendance trends. These insights help administrator monitor hospital performance, allocate resources effectively, and respond proactively to emerging challenges. Using this navigation panel, administrator can manage the health centers align in their district. They can register new health center as well. Patient history and details. You can register a patient over here. This is to check the availability of medicines, to check how many are there in stock, how many are out of the stock. The bed history shows the availability of currently available beds, occupied beds, and how many beds are under maintenance. The attendance will showcase the staff attending today, their logs, on which time did they enter, or how much time they spend, or how when they check out. In management, you can see the report. You can as well generate a report by giving a PDF URL. This should be their weekly, monthly, or daily summary. These are the centers. These are the user details. This is the notification where you can get the info, warnings, and critical signs. These are the logs. Last but not the least, in setting you can add the parameters. Now let's shift our focus on facility dashboard. This is a facility dashboard. You can see the patients registered today, then the bed available, then the medicine stock, as well as the attendance of the staff. As we have gone through the district dashboard, the same navigation panels were there As you can see, the patient, medicine, beds, attendance, report, user, notification, setting, and same dashboard, but with the limited permission. Here you can only register patients, you can add medicines, you can add beds, you can update the status as well. You can mark the attendance. And generate report. Here is the graphical representation of patient registration trends as well as the medicines available in the stock. Here you can see the inventory is fully stocked and here the patient visit channel. Now let's shift our focus to healthcare staff dashboard. You can see the same navigation panel but with the upgraded restrictions. As the faculty dashboard of healthcare staff is only allowed to registered patient, locates the bed availability, check the stocks and presence of staff. Here they cannot do attendance manually. Now let's shift to operation staff. Same with this dashboard have the same navigations which were there in the previous, but which they can only see patient registration trends and critical medicine stock levels. With this, instead of spending hours collecting information from multiple departments, administrators now have real-time visibility into district-wide healthcare operations, enabling faster decision, better coordination, and more effective healthcare. If it implements across various global government hospitals, this solution can be streamlined operation as well as reduce delays and the manual documentation problems. This result is a better coordination, optimizing times of the patient as well as utilizes more resource very usefully. Beyond digital transformation, this initiative contributes to United Nations Sustainable Development Goals that are SDG goals, SDG 3, Good Health and Well-being, SDG 9, Industry, Innovation and Infrastructure, and SDG 16, Peace, Justice and Stronger Institution. Because stronger healthcare only builds with the stronger community. And that is the impact we strive to create.